keeping an open mind. I grew up in the Midwest and had never lived in California. And prior to coming out initially for my residency, and ultimately led to my fellowship. And I consider that decision and move to be one of the best decisions that I ever ended up making in my life, and one of the most positively rewarding. And I don't know if I would have considered it had I not kept a very open mind about where to go for my training. So my recommendation is be open and take a chance on some place that you maybe even never considered or lived before, because you may find it to be a really wonderful fit.
Thinking about ways that you can explore things that feel uncomfortable for you. So the fellowship is a really nice time where you can experiment with different communication techniques or treatments, medications or approaches, like complementary stuff, and just really get a well-rounded tool set that, with the support of your attendings, prior to going out and having to practice on your own. So that's just a really wonderful support network to experiment and grow that you really won't find much after fellowship.
Encourage applicants to think about ways to potentially practice both specialties. In addition, it would be good to travel to 2 different places across the country and check out different programs to see their strengths and weaknesses, so you can choose wisely for your fellowship training program. Obviously, I'm biased. I am very happy that I went through UCI to be trained, but I think it's advisable to check out different places. So if at the end of the day you're going to be happy with your choice, regardless of where you end up training at.
Myself, as an applicant, it served me well to really give a lot of thought to why I wanted to do this. Again, I went back to residency to do the palliative care fellowship when I was 40. And I think everybody who interviewed me had questions about that. Is this going to work? Is this just a midlife crisis? And before I could give them honest, meaningful answers, I kind of need to have those honest, meaningful answers for myself and to really think about it. And that may seem obvious, and if it is, I apologize, but I think it's worth taking some time and maybe even writing down on paper what your thoughts are about the program, what you're hoping to do, why you want to do it now, what you're hoping to accomplish, why palliative care instead of something else. And I think taking the time to get your thoughts organized and maybe even put it out on paper is really a benefit when it comes to interviews where you'll definitely be asked the simple questions like why? Why us? Why here? I guess that's another part of it. Something I recommend to the applicant is do some research on each program you're looking at. All of the programs in some ways are fundamentally the same, but they all have real differences. And most of the programs are proud of what they have to offer. And so if you can do some research and go to your interview and say, this is what I like about your program in particular, it's going to give you a sense to communicate to people that you are a good match for this program. Not just that you're interested in any palliative care program that accepts you, but you're really interested in UCI.
To take advantage of every opportunity that the UCI program provides, and there are many opportunities.
The advice that I would give to a UCI applicant is, first of all, at all of your interviews, just be yourself, speak from the heart. When it comes down to it, this is only a year of your life, and you want to take the most advantage of whatever that year of your life is, whatever setting it is. One of the reasons why I especially really liked UCI was because they offer a 1-month rotation in pediatrics compared to a lot of the other programs only offer 2 weeks or some kind of integrated experience. And especially for me, having a family medicine background, that was really important to me to have a little bit more of a pediatrics foundation. So that being said, you get the most out of what you make of it. So if you go into a rotation that you don't really care for, you're not going to learn. Versus if you really want to learn the best that you can, you need to be proactive in whatever fellowship that you would pursue.
Make sure you research your program well, because you're going to be there for a year, but the interactions that you're going to have with your co-fellow and your colleagues will last a lifetime.
So the recommendation that I would give to the applicants is when you look for fellowships, make sure you find a fellowship where the fellows are there to learn and not primarily to help take care of patients, but to learn. And so that'll make a difference because it'll allow you the freedom to take the opportunities that are most educational for you. And the way that you can find that out is you can ask them, can the service run without the fellow? If the service needs a fellow to be there to run, then it's likely that the fellows are dependent on for service. Here at UC Irvine, there are often times where there's no fellow on service here, and the service still runs fine because the attendings are there to care for the patients. And so when you're there, you do help care for the patients and help with the patient care with that load, but you're there to learn and to see the cases that are most educational, and that's very helpful for you not only in your learning but also in your overall quality of life and your work-life balance.